Facelift surgery for me is something very specific, exact. It's something where I actually evaluate the patient and see how the patient's face overall is aging. There are many techniques that we can use where we lift the brow, we lift the midface, lift the cheeks, lift the neck. And I try to apply the different techniques in different patients depending on what their needs are. I don't use just one technique for every patient, but I basically use the techniques necessary to make that patient reach their goals in a very natural way. Many surgeons will use the same technique for every patient. Because I tailor my facelift techniques specifically to this patient and to their needs, I feel it's a more exact but custom approach to the facelift. No one technique, but many techniques to reach the ultimate goal. The most successful facelift result is one where people around you know you look better, you feel and look refreshed. They see something changed, but they may not know exactly what happened. Your scars are not visible. The changes don't change your natural look. You look refreshed, you look more youthful and natural. That to me is a successful result. I think some patients actually come and look for extreme looks. I basically lean towards a more natural look, both by addressing their concerns, as well as in the OR, not overpulling and overdoing. The goal is not to make them look operated on. So not everyone needs a facelift. There are people that are in different phases of their aging journey, where they may just need a slight lift. They may need a little Botox or a little filler. That doesn't mean they need a facelift. Depending on what the patient's goals are, we have all these options available here in the office, and we're willing to work with you to transition from minor things to something bigger, or start off with something bigger depending on what it is you'd like to do. So one of the things I'd like for someone that's interested in a facelift, that's considering me as their surgeon, I would say come have a consultation, talk to me. Let's see if we can address your concerns. If that's something that resonates with you and makes you comfortable, then we'll go through all the techniques and all the things that I can possibly do to help you. So the one thing I want you to know is that I'm there with you. We'll do a great job, and your friends will be able to see a very natural result in you, and you'll be very happy.